Back then, it really felt like fishing bodies out of the river.
Hi Nancy, this is Claudia Linhoff from Champaign County Healthcare Consumers, returning your call at long last.
Before the Affordable Care Act, so much of our client work focused on trying to help people with really impossible situations, people who had major health crises, who didn't have health insurance, or lost their health insurance because of those crises, or had never had health insurance because they couldn't afford it. We had clients who had diagnoses anywhere from cancer to they had had a massive heart attack, or I remember a lady who had really, really severe fibroids. So a lot of our work was when their health situation got so bad that they absolutely needed health care but didn't know where to go to get it or how they were going to afford it. You know, the stakes were very high. One that comes to mind is a lady who, she would have these occasional falls.
My mom did not have a regular physician. Starting in 2008 and then in 2009, she kept falling periodically. And in May of 2009, she called me up and told me that she had another really hard fall and that she thinks she might need to go to the hospital. So I went over to her house and she had a terrible black eye. She looked like somebody hit her with a baseball bat. And so we took her in that May of 2009 to get her eye looked at, and the doctor within an hour came back and told her that she had stage 4 lung cancer and that it had metastatized to her brain, and she had over 10 tumors in her brain. And she died about a month later. I think if Mom had preventative care and had regular checkups and had been able to access health care without having to worry about getting billed too much or racking up bills that she couldn't afford. She was so terrified of that stuff that she avoided regular routine checkups. And certainly this could have been something that could have been caught, or had it been caught early, we might have had a better chance at fighting it.
Now we still see a lot of clients, and in fact we see more clients, but it's completely different because now we're helping people sign up for health insurance. We help them get connected with a primary care physician or a specialist, and we sort of send them on their way. But I don't have to call and beg a doctor to take my client pro bono. Now they sort of have a passport. Thanks to the Affordable Care Act and the Medicaid expansion and all that, they sort of have a passport to get into the care that they need. If the Affordable Care Act went away, it would be devastating.